Anywhere between 25 to like 50% of intact female dogs over the age of 7 will experience a pyometra. About 80% of the people that I say your dog has this infected uterus, it's a pyometra, they had no idea that this was a thing. That's a life-threatening situation.
Also, when people go, okay, well, infected uterus, you're going to see that it's going to be a pussy discharge. They're not always visible. You can have sort of a slow, progressive change, or you can have them present really sick very, very quickly. Welcome back to the Paws Effect Podcast. I've got Dr. Deer in the studio, essentially online with me today, and a very warm welcome back.
Hi, yeah, thanks. It's good to see you again.
We had a great discussion last time and we tapped into myths and misconceptions, and I think it was very well received, certainly by my listeners. And we had some reels that went out on our social media platform that inspired or certainly started a lot of conversation. And the one reel that I was delighted that you took over the comments on was about castration. And it made me realize, geez, this is very, firstly, emotive, secondly, misunderstood, but it's something that requires clarity. And maybe rather than just having a little extract, we can have a discussion about it and people can make up their own minds. But it's a really important topic. So thank you very much for agreeing to discuss it with me. It's much appreciated.
Thanks for having me again.
So I thought we could just have a bit of a discussion about castration and just provide some. So can you please start off by clarifying what is castration? It's termed different things in different countries, but ultimately castration is the same thing.
Yeah. And castration, to me, I guess, would be removing an animal's ability to reproduce. For some people, that means like completely removing in a male, animal situation, completely removing the testicles. Other people would see like vasectomies as a form of castration. And then on like the female side, there's different types where do you just remove the ovaries? Do you just remove the uterus? Do you remove both? But a way of making it so that an animal cannot reproduce would be, how I would term castration.
And there obviously are different techniques and, like you say, different approaches, one being a surgical procedure. Can we discuss the surgical procedures just to start out? Because that is typically what we're doing commonly. The other techniques are obviously reserved for particular situations. I'm sure we'll go into it and provide clarification on those.
Yeah, and I'm really only familiar with the surgical technique aspect of it. We don't tend to do like chemical castrations in the United States, at least not very commonly, especially not like a GP practice. But on like the male side, you're talking about either removing the testicles or cutting the line basically from the testicles so that they're not producing. They're ejaculating sperm, versus then on the female side, you can either remove the ovaries, you can remove the uterus, or you can remove both. And there's a lot of different reasons why people decide to do different ones.
Absolutely. So the topic generally of conversation goes, you will have breeders, and I suppose we can touch on this now in terms of the chemical castration. We have had a few people ask, particularly breeders, who are saying, I need just to interrupt this for either training purposes or because I have an intact female and I don't want to have an incident. We may get some requests of people just going, I don't want to surgically remove this dog's testicles. And we can discuss why in a minute. But obviously, chemical castration is something that it has some pros, perhaps, in particular situations, but is not typical because it's really expensive and it doesn't last very long. It's not a permanent solution for most people. But then we also have the situation where people are not necessarily wanting to lose the aesthetics of their dog, and they're very persistent on the fact that they want their dogs to feel like male dogs, for example, and are very scared about the procedure. How do you approach these kind of conversations just to provide absolute clarity to the owners about the decision they're making and that it's correct for them?
Yeah, and you kind of have to separate the people who are kind of anthropomorphizing from the people who are looking at it from like a performance standpoint. Because I have heard people have conversations about like, this is my dog that I am doing like, active work with, and having those sex hormones or having like a certain look to them is very important because otherwise they're not going to do well. Versus like the average person who may say, well, I wouldn't like someone to remove my testicles. So like, why would I do it to my dog? And so first sussing that out, because those are two very different arguments. And then also they carry different weight, right? Like on one hand, you're talking about someone anthropomorphizing their pet and trying to like see themselves in their animal. And then on the other hand, you have people who have like very valid concerns, for performance and show and everything. So that's kind of the first place that I start. And then from there go to, okay, in the anthropomorphizing section, what can we do to kind of, where are those beliefs coming from? And is this something that I can tackle today? Or is this a deep rooted belief that like, no matter what I say, it's not going to change their opinion? And, I think that's like where Neuticles come from.
Yeah.
We have those in the United States. I don't know if everyone has them everywhere, but basically, you remove the testicle and you replace it with a fake testicle. So the dog still looks like it has testicles. I'm not personally a fan of those options because I've heard some pretty interesting things about like potential side effects and complications. But that's kind of a good place to start, is to see, okay, where is this worry coming from? And is it founded, or is it mostly an emotional worry?
Absolutely. And I must say, I can't believe it because I have not checked this fact, but I read somewhere that over 500,000 of those implants have been sold worldwide. So there are clearly people out there who are purchasing them. And I was shocked. Because they're not without their complications, as you said. I mean, with any implants, I think people can relate to breast implants, and we see the sort of consequences and the side effects of various things that we're doing. And it's all very well to say, look, I want an aesthetic look, but if it's for you or for your pet, because it's certainly, like you say, you've got to understand where this comes from. So it's a good point. So generally, we have those clients who come in, and our discussion today really, for me, is around the age of doing it, because we were very comfortable historically having our new puppy into our vaccination consult and saying, look, do microchipping, we're going to do vaccines, and this is the time you're going to come in and have them spayed or castrated. Thank you very much. See you in not 6 months, see you at 6 months. Mm-hmm. And now, even the vets are a bit nervous about advising, because their owners are pushing back saying, no, hang on a minute, that is old school. And I have a large breed dog, and I want this dog to reach skeletal maturity, and I don't want to castrate them too young. Can you explain your experience of this consultation and how you handle it in terms of informing people of the pros and cons?
Yeah. And I'm very lucky being an ER doctor that I don't have to have these conversations every day. I do have them though, because I do see puppies and everything, but, kind of there are a few things to talk about, or kind of a few ways to approach it. One is understanding that the data that's behind both sides of the argument are not necessarily like very robust, right? We've got this long history, like you said, of us doing spay neuter at earlier ages, come in at 4 months, come in at 6 months, because historically owners' ability to come back and get vaccines and actually spay and actually neuter was very low. And so if they weren't coming in during that mandatory rabies vaccine, we would probably never see them again. And so in order to make sure that the pet population was under control, that's where a lot of that came from. Same on like the shelter side. If you adopt out a dog that's not been spayed or neutered, the likelihood of them being spayed or neutered isn't as high as if it was already before they left. And then when we start getting into those large breed dogs, there is evidence that certain breeds of dogs, things like ACL tears, do have like a higher incidence in these animals that are not intact or that were like spayed at certain ages. But the data is really conflicting. And that's where it gets really frustrating, because we look at this data and it would be so nice to say, here are our criteria. But so far, our criteria has come from really small sample sizes and has, I think, ignored a big genetic component. And that's really where my argument comes from, is when we look at these breeds and we say, okay, if spay and neuter caused an increase in ACL tears, then we would see every single breed would have higher instances of ACL tears when they're spayed and neutered. And that wasn't the case. Even in these data sets that we've done that are, again, very limited, we're not seeing it consistently across every breed. We're seeing that breeds that are already prone to this problem have it at a higher rate sometimes, but not consistently. And sometimes if they're spayed before 6 months, and sometimes if it's between 6 months and 12 months, and sometimes if it's between 12, it's just like so inconsistent for you to say, okay, here's some hard and fast rules. And so that's where it gets tricky, is because one study comes out and it says we looked at 300 German Shepherds, just to throw a breed out there, over 10 years. And we found that if they were spayed between 6 and 8 months, they have a higher rate of GDVs, just to throw just something out there. And then you say, okay, well, where is this study taking place? Why are we looking at 300 dogs of a very popular breed and making decisions based off of it? So I think that's where it gets kind of tricky to say, to have these conversations with owners, because you want what's best for the pet. You know, you don't want this dog to get an ACL tear, but you also don't want it to get a Pyometra or mammary cancer. So now in your 15-minute consult appointment, you're having to explain the nuance behind these studies and say, yeah, I agree. Having your Labrador Retriever that you take hunting with you, having an ACL tear could be catastrophic to, you know, that dog's life, that dog's livelihood, the reason that you brought them into your household. But we also have to consider, what is the actual rate of ACL tears in this breed? What did that rate become with spay and neuter? Because if it went from 2% to 4%, do I care as much? Versus when we look at the rate of like mammary cancer and after certain heat cycles, or the likelihood of Pyometra. And you're trying to explain this in these 15-minute appointments. And I just don't think it's feasible, because there's too much nuance and there's too much, I don't want to say conflicting evidence, but theories that have been derived by very small data sets that are in very particular segments of the population. And not only that, but when I've talked to some breeders hate these studies because they're saying, well, my line doesn't have these problems. How do we know these are purebred dogs and not just owners claiming that they're purebred dogs because they're retrospective studies? So like, very long conversations to have with very nuanced discussions that you just don't have the time or ability to do, you know?
Hey there, pet parents. It's Dr. Kara, the Ultra Pet vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers a 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. And very technical, and I think also for owners or listeners, certainly to this podcast, to realize 300 dogs may sound like a lot of dogs, but in a study, it's not an adequate number. And having correlations between, like you say, one thing and another doesn't mean that they're related. So I think to try and explain that to people, they think like 300 dogs, that's a lot. So when we're looking at scientific data and looking at whether it's reliable, we are wanting we're wanting thousands, hundreds of thousands. We've got a huge population of dogs, and we do not want to base our decisions on a small sample size.
Mm-hmm.
Yeah.
Yep, absolutely.
So I mean, you spoke about, obviously, let's talk about the issues we see. And this is not punting, this is so the owners can make an informed decision. So some of the things you spoke about in our female pets, you spoke about mammary tumors, you spoke about pyometras, ovarian tumors and whatnot. So these are things that we commonly see, obviously, if they're intact. So they haven't been spayed. What is the kind of incidence of that? Are you able to advise owners of the likelihood of their pet getting a pyometra?
Yeah, with Pyometra, it really depends on some studies, but anywhere between 25 to like 50% of intact female dogs over the age of 7 will experience a Pyometra. And that's a life-threatening situation, and when you're talking about some of the other concerns that people have when they're talking about these early spay neuters or spay neuter in general, they're talking about like an ACL tear, which is not a life-threatening situation, versus a pyometra, which is a life-threatening situation. Being ER, I mean, pyometras are my least favorite cases because they are so preventable. And I would say about 80% of the people that I say your dog has this infected uterus, it's a pyometra, we need to go to emergency surgery, like your dog could potentially not survive. They have never heard these words in their entire life. They had no idea that this was a thing. In humans, it does occur in humans. It's like 0.4% of like postmenopausal women. So it's not even something that happens in humans where you can say, oh, it's just like in humans. This is a very weird thing that occurs in dogs. And I would say even cats. Our spay neuter is much better kind of in cats, at least cats that are owned by people. And so I still see a fair amount of pyometras in cats. So it's, and I don't know that we have any stats on cat pyometra. I've never looked it up, but it's pretty common.
It is. And I think the point you made is, I mean, you see these in ER situations, and that's often because you'll have them deteriorate very quickly, but also when people go, okay, well, infected uterus, you're going to see that it's going to be a pussy discharge. They're not always visible. You can have an animal that loses condition and it's a sort of a slow progressive change, or you can have them present really sick very, very quickly. And I think that's the scary thing about then having to anesthetize them and manage that in an emergency type situation. It can result in a less than favorable outcome.
Mm-hmm. Yep, absolutely.
So let's talk about mammary tumors in our females before we go back to the boys. The mammary tumors, explain to the listeners sort of how they occur and why they occur, particularly in intact or having a delay in spaying our dogs or our bitches.
Yeah. And, this is always such a really interesting one to talk about, especially nowadays, because the studies that looked at when these dogs develop mammary tumors, basically they looked at if you spay a dog before its first heat cycle versus between its first and second versus between its second and third, what are the percentage chances of them going on to develop mammary cancer? And some people feel like those initial studies were very flawed, and they haven't necessarily been repeated. And so some of the numbers that we threw around for a while that said like, what was it, like 0.8% if you spayed before your first, it was something very, very small. And then it bumped up to like 10 to 15%. Yeah. And then after like 2 or 3 heat cycles, it didn't matter. It kind of flatlined. It seems like these days, we're not sure if that's 100% accurate. But I think what the worry becomes is that mammary cancers can be malignant and they can spread. So especially cats, I think it's like something like 50% of all mammary cancers in cats are malignant, which means that they spread and they can be really aggressive. And so we're not just talking about the likelihood of developing just tumors or cancers. You're talking about a type of cancer that's very hard to remove. When they're small, sure, you can go in, but you're talking about doing a mastectomy. And we can understand that term because we use that in human medicine. But doing like a mastectomy to remove these tumors that developed because we delayed spaying. So that's where it gets, that's kind of where that discussion is as well. Yeah.
And often it's radical. It's like, I'm not trying to make the comparison and play down how serious and painful and high risk a mammary resection is for a person. But, in our cats and dogs, we're often removing chains of mammary tissue, and it's a big procedure. So definitely, and then you wait and have to hope that it is something that has not spread. So it's a frightening condition to have to end up with, particularly if it is preventable. So I totally agree. So let's go back to the boys, and let's talk about the benefits and why we generally advise. Let's say a small breed dog is castrated at 6 months.
Yeah, like the small breed dogs where we worry a little bit less about, the sex hormones in joint development or closing of growth plates or anything like that. When they look at neutering, I don't think people have as strong opinions about age of neuter when it comes like from the veterinary side where we're saying, oh, we're very pro neuter. I think it's the females that we're a little bit more adamant about because there's a lot more disease that's tied to keeping them intact. And then when it comes on like the male side, there's discussions about behavior. And you will find a very interesting line that people sit on. Some people believe that neutering causes behavioral issues, whereas other people believe intact dogs have higher rates of behavioral issues. And for every study that tells you one thing, you'll find another study that tells you another. They've even had like Guide Dog, I think it's like Guide Dog of America. One of the guide dog associations has looked at it in like their Labrador retrievers. So breeds that are not known for aggression by any means, looking at, neutering them. And then is it because you neuter them during a fear period? Is it because of this? Is it because of that? So a lot of the discussion I feel with male dogs is behavioral. If they're not intact, they're not going to go looking for women, they're not going to go looking for tail.
Yep.
And so like decreased roaming behaviors, aggression is also something that I don't know that we 100% agree on either, because you've got the behaviors that exist. If they're already there, neutering a dog is not going to change that. So if they've already developed these behaviors, I think a lot of times people are like, oh, well, this will help. And so I wonder if that upsets the stats with these subsets, is that sometimes people neuter their animals for behavioral reasons. And does that mess up does neuter affect behavior? There's also things like prostate. So neutering dogs, intact male dogs can get these, very big prostates. I've seen some dogs not able to urinate because their prostate is so big that it's compressing their urethra and now they can't urinate. Neutered dogs can get things like benign prostatic hyperplasia and everything and cancers. But I feel like most of the discussion amongst the neutering is like a behavioral discussion versus like a medical discussion, which makes it so interesting that it's so different between the two.
No, you're absolutely right. And I mean, I find and it's very difficult to change people's minds, even when presenting them with the facts. I often, take the approach, like you said, the prostate is something that a lot of people can relate to, because unlike the conversation of breast tumors or pyometras, a lot of people can't correlate that to having a hysterectomy, whereas older men get prostatic problems, and older dogs that are entire get prostatic problems, and whether that's just a hyperplasia or a neoplastic disease. But we also have the same in testicular tumors and torsions. And so, if people are aware of those things and they still say, no, but it's a behavior, the behavior is the key to changing their minds. I think most people are so fearful of having a dog that's not going to work for them longer term that they want to be making the right decision. But you spoke about growth plates and joint disease and hip dysplasia and cruciates. So explain to the listeners the benefit of perhaps delaying it a little bit longer, not necessarily not doing it so that you end up with these prostatic problems or testicular problems or behavioral problems. What is the benefit of having the discussion and potentially delaying it for a little bit longer?
Yeah, certain breeds, it's, we have some evidence, and again, small sample sizes, inconsistent data, that delaying the time that you castrate an animal may decrease the likelihood of certain joint or growth disorders, right? Because if you think about the sex hormones that the animal is going to have, and those can, help with maturity of the skeleton. And if you're waiting until the growth plate's closed to remove those hormones, are you like creating a little bit more of a stable foundation, I guess is the easiest way to describe it. And I know something that I've always been really interested in, and I've kind of followed, is its effects on like intravertebral disc disease, because there is some evidence in like dachshunds, and I think this is something that for whatever reason people don't talk a lot about. They're always talking about like ACLs and everything. In dachshunds, that if you delay castration, that you may have lower incidences of IVDD. And to me, if I'm comparing things that I care very deeply about, I care a lot about IVDD. That's can be a life-ending injury versus like an ACL tear, And so looking at like breeds that aren't necessarily large breed dogs, but dogs that have these disorders like intravertebral disc disease. I haven't seen any evidence with Frenchies on that yet, but I've kept an eye out because I have Frenchies and I'm terrified of IVDD. But the other thing that gets really, frustrating with that, going back to talking to owners about it, is now you have these hundreds of breeds that each have different recommendations, that have different data sets and different ideas behind it. And so trying to make these like tailored recommendations gets how can you keep up with this data and know what's the current consensus?
Yeah, and it's confusing. It is confusing, and it's difficult when we're in practice and we're not what we feel. I mean, we all attend CPDs. We all are interested in this topic. We want to understand. We want to best support our clients, and we want to have or allow them to make an informed decision, particularly, like you say, with some of these things being life-threatening and others that can be managed and can either be medically or surgically managed. And I want to get your perspective and your advice, and this is going back to the females, when we have a bitch that presents with urinary incontinence and how that may impact the advice that we're giving them and why.
I think when we're having these discussions, sometimes we can be really dismissive of the potential complications of castrating animals. And when we think of female dogs, in particular, in certain breeds, urinary incontinence is a known complication of spaying, and it's not necessarily like an early spay that's the issue. It's just spaying in general. They call it spay incontinence. And so these are dogs that can get things like urine scald and chronic UTIs, and they pee in your house, and it's very frustrating. And so, that's kind of it's not common, but it's not uncommon, And so we can't be dismissive of the potential complications that come with these surgeries because, we act like spaying and neutering is just, it's just a spay, it's just a neuter. Spaying is an abdominal surgery. If you were a human and you got spayed, you'd be out of work 6 to 8 weeks, And so they're very involved surgeries that do have these side effects. Yeah, so if we have these certain breeds of dogs that we know are already prone to these issues, that's a very open discussion we need to have with these pet owners.
So it's taking a lot of things into consideration. It's actually having an adequate amount of time to give owners an opportunity to hear or the full picture, but also to help them disseminate the information to make the best decision for their pets. Because some of it is, if we as vets are having this conversation and going like, oh, I don't know, like, is this breed predisposed? Is there a list? Is there somewhere where I can actually get this information? And I know that there's a lot of information out there that does support us in terms of providing the current thoughts or using the latest data in order to inform us as professionals. But I'm not surprised that owners get totally confused, or they take a small piece of information and they stick with it and they don't consider another perspective. I want to talk, I mean, you made a mention, obviously, when we are castrating our male dogs, there are there are potential side effects of castration. There are potential risks to castration, and I'm sure you see them in your ER. Same with the females. Can you tell me the kind of complications that you see after hours with these procedures?
Yeah, I'd say, and especially when you're talking about castrating earlier in life versus castrating later in life, the complications are different. And that's something I don't think it's talked about when we talk about delaying these procedures, is that there's an increased risk with the procedure itself. Like, for example, if you're castrating a dog, like a young male dog, and you're removing his testicles, there's not a whole lot of space where those testicles were. Versus I had this dog that I actually saw 2 nights ago, and it had what we call scrotal hematoma. So it was a 3-year-old, very cute, very beefy little pit bull, and he had been neutered that day, and he was so excited to go to his new home that he freaked out and bled into his scrotum. So he looked like he hadn't been neutered. And that can be that's something that's manageable. You put them on things to keep them calm. You do some icing. But sometimes that scrotum then needs to be surgically removed. And now you're talking about a whole separate procedure where they're going back under anesthesia to remove their scrotum. So I'd say that's the most common complication I see on that end. On the female end, when you remove a uterus of a young puppy that hasn't gone through any heat cycles yet, the uterus is like this tiny little, like not a lot of blood vessels, little thing there. And then the puppies don't tend to have like a lot of body fat. But as they get older and they go through multiple heat cycles, the uterus is bigger. It has more blood supply to it. It's more friable. And so the complications that I tend to see for those ones are bleeding in the abdomen, which is a very serious, potentially life-threatening, where you have to go in there and you have to find what's bleeding because either a ligature slips or there's just so much blood vessels in there that they just ooze and ooze and ooze, and they can bleed to death. And so that risk is much higher when we delay spay because we've allowed that uterus to mature and look that way. And then some other complications are mostly just like the incision size. So most of our like spaying that happens in these high volume situations, the incision is like this big. Versus where you're getting in there with the older dogs, the incision gets bigger and bigger because you gotta really get in there.
Especially with the Pyometra.
Especially with the Pyometra. Yeah, my incisions are like this.
Huge.
I could never. I always joke that if it doesn't have pus or puppies in it, I can't find a uterus. Again, ER. So, but those incisions falling apart is another thing that I see on the ER. I had 2 of them that I repaired the other night where the skin just opened up, or one of the 2 layers opened up. And so those are, other complications that we can see from like a surgical standpoint. I know we talked about like spay incontinence, but generally I feel like the immediate kind of post-op surgical complications are the ones that I see the most on ER.
And how can owners sort of mitigate some of this risk? Obviously, you see that cone of shame, but in terms of rest period and exercise and activity, and also sort of barriers, what is your advice generally when you see them?
Chemical restraint. I do love sending home medications that keep animals calm for any procedure. So if I've done like a Pyometra surgery, I will send them home with like pain medications, anti-inflammatories, and then sometimes sedatives or anti-anxiety medications because, some of the younger dogs that you're spaying, you're trying to tell a puppy that it can't play and run and jump and be a puppy. And so they do need a little bit of that chemical restraint to keep them from causing those injuries. Some dogs, if you put a cone on them, they're going to cause their own problem. And so I do really like those surgery suits. I don't know if you've seen them before. They're little like onesies for animals.
Oh, cute. No, we don't really have access to them here.
Very cute. They look like little pajamas. Those work really well. I'm not a fan of the donut because I feel like most animals can get around the neck donut. But yeah, I'm definitely one of those people who I send home a lot of medications for so that owners have them when they need them and they're not rushing into the ER at 2 a.m. because they can't keep their dog quiet.
And what is your general advice in terms of returning to normal activity?
Usually I want like 10 to 14 days for most of my procedures, just because I want to make sure that there's like an adequate amount of healing that's gone on. I say that knowing that I'll be happy with 5 to 7. You kind of ask for a little bit more because you're not going to quite get it. But generally at least a week, please.
Definitely. So let's talk about owners taking our advice and saying, okay, I'm going to spay or neuter or castrate my pet. But what I hear a lot is, but they're going to gain weight. How do we best support our owners in terms of metabolism, diet, exercise for these patients?
Yeah, I mean, this is why I love telling people that these decisions should be about your pet with your vet, because that's another great discussion to have. I know that some brands of dog food have come out with like spayed or castrated animal food that has like a little bit lower calorie content, maybe a little bit higher in fiber, things to try and make animals feel fuller longer. And then also knowing like what the activity level of that animal is. If your dog is just going to like sit on your lap all day, you've got like a little Frenchie that you don't anticipate it's going to be doing much. You want to make sure that you're talking about like calorie requirements. What does a good BCS look like on these guys? Should they come in and even just like on days that they're not there to be seen, just get a weight just to make sure we're not trending upward. They're not putting their pants on every morning and being like, oh, these are getting a little tight. So someone has to have some way to monitor their weight. But that's part of that nutrition discussion that I think everyone should have with their clients.
Very much so. And I think, any procedure or anything, it's sometimes with time and people get accustomed to having their pets around, they've got a great amount of energy when they're a puppy, and then life gets in the way and the dogs sit and do nothing, and we all fall out of routine of monitoring, but also exercising our pets. And so, it's something that we tackle quite a lot. And then it gets blamed on while they were spayed or neutered too early. And those are things that we can sort of mitigate if we have a discussion very early on. So we spoke about the tumors. One of the things I wanted just to get clarification on is this open and closed cervix, and warning people of the typical signs. If they choose not to, let's go to the females, they choose not to spay them, and whether they're breeding dogs or for whatever their reasons, they choose to keep them entire. What are the kind of signs that you can warn owners to look out for potential Pyometra?
Yeah, and I think owners that are delaying spay in these dogs are already owners that are very involved in their pet's life, and they are very aware of like their pet's health, their diet, their activity level. Like these are already owners that are very, very invested in their pet. And so they're going to be ones that notice very quickly if something is not right. And sometimes the first symptoms that we see of things like Pyometra are just lethargy, decreased appetite. And so it being a little bit off. I've had people say, she's looking at me funny. They're just these like very vague signs that they can start with. Increased thirst, increased urination is another one that we see really commonly. And those would all be things. And they tend to happen within a few weeks after their last heat cycle. So following a heat cycle, those few weeks after, paying very close attention. And then just anytime something seems not quite right, going in to be seen.
Yeah. I also wanted to speak to you about the timing of, say, a mature bitch in terms of spaying them. So you made mention of the fact that obviously the uterus is supplied by blood vessels, and during preparation for a pregnancy, that blood supply becomes very prominent, and it's not an ideal time to obviously spay them. What is the advice, and how often are you seeing issues associated with a pseudo pregnancy by spaying them at the wrong time?
Yeah, and I don't see those very often. I think those are like really good questions for Therio or GP. I think that just having that discussion with an owner and saying, okay, so what breed of dog is this? Okay, perfect. Do you know who the parents are? Is there any issues in their lineage? Okay, has any previous litters or cousins or whatever had orthopedic issues, had certain issues? Okay, so we need to keep those into consideration because again, I believe that genetics are a much bigger factor than castration status is my personal opinion. And starting with that and then being like, okay, so we know that this dog is going to sit on a couch all day. They're not going to be hunting. They're not going to be. So maybe we care a little bit less about CCL tears or anything like that. Okay. This dog, it's not a breed that's known for it. The owner cannot. This week they have off from work to make sure that the dog's not running around. So we can schedule it during this time. Maybe it's before this time. Just having those very nuanced discussions. I don't think that spay consultations or neuter consultations should be 15-minute appointments. To me, it's a 45-minute to an hour appointment that maybe you've sown the seeds during like previous visits during like vaccination. And now that it's time to talk about a date, that's when you can really hash out okay, you're a large breed dog. We may delay this a little bit. Let's have this conversation at 6 months,
Yeah. Yeah. And then let's discuss behavior. Let's discuss all the factors that may be relevant, particularly during this time frame. Mm-hmm. So back to our boys. I want to talk about the retained testicle. How do you best advise when there is either one or both of the testicles retained, and if you can give the listeners an insight as to why it's a really important consideration?
Yeah, so those retained testicles, if you're looking at a dog and they just have one testicle, the other one is up somewhere where it's not supposed to be. And I have seen those become cancer. So that's kind of a crazy thing that can happen is that testicle, if it sits in the abdomen, it can develop a type of cancer. It's called a Sertoli cell tumor. These Sertoli cell tumors produce these hormones. And so you can see things like bone marrow suppression. These dogs can be profoundly ill. They're huge. They take up a lot of space. So we don't want that testicle sitting in the abdomen with this potential to become a tumor. The other thing is we know that there is a genetic or heritability behind those retained testicles. And so we don't want that animal intact anyway to breed and pass that on. It's not a trait we want to continue on. And so those are big reasons that you don't want to just leave that testicle. Some people will wait until they're like 4 to 6 months to see if it descends a little bit more. They're a little bit easier to find if they've at least made it halfway than if they've stayed in the abdomen the whole time. So giving it a little bit more time to get where it's supposed to be, knowing that it may never.
It may never pop out.
Yeah.
So the other question I get asked is, can I castrate them when they come in for a dental procedure? What is your general advice on doing clean procedures with potentially dirty procedures, and what's your opinion on it?
Yeah, I think that would be one of those situations where I would wonder if there's a financial reason for it. I do work in very low income areas, and I understand that this may be the one time this animal will ever go under anesthesia for anything. I have like doing C-sections and removing the uterus at the same time is not always recommended. It's kind of against the current recommendations, but knowing that maybe this owner could not afford to do a spay in the future, like this is the one chance. Then I don't think that that's necessarily wrong. Is it gold standard? No. Is it generally advised? No. But you have to know your client and you have to know what they're capable of. And if this is something where they're like, hey, while they're being neutered, can you pull that rotting tooth that's been bothering them for, I can't really fault people for doing that because what's the alternative? They just don't get it done.
Exactly. And then they end up with a very expensive problem several years later. No, I'm in agreement. I mean, I think circumstances obviously dependent on the case, but we'll get something that comes in for a laceration and they go, well, while they're under, because people, the affordability of of that anesthetic fee, can you just do it at the same time? But I know that there are very strong opinions about dentals and any surgical procedures.
And I've done foreign bodies and neuters at the same time because same situation. Why not?
Yeah. So I don't want to lose the opportunity because I think this has been really informative. But when people are listening to this, they're going to be like, but you didn't put enough emphasis on the fact that this is population control and all the unwanted animals and the number of pets being euthanized because they end up in shelters and so on and so forth. Obviously, we are appreciative of that, and I'm sure that you feel quite passionate, as I do, about not having a population that's uncared for. What is your general approach on that welfare situation, the welfare organizations?
Yeah, and I think we talked about this the last time that I was on the podcast. Is that I went to school in Mississippi, and in Mississippi, spay and neuter is considered a life-saving procedure. If you are not an animal that is not spayed or neutered in a shelter, the likelihood of you being euthanized is very high. So from that perspective, I mean, they literally had so many animals in some of those shelters that they shipped them up to the northern states to find homes, and people have really, the discussions about sending disease, but whatever. The point being, there are so many animals that are stray, intact, roaming animals that spay and neuter is considered life-saving. Now being in Phoenix, same kind of situation. There are parts of Phoenix where there are stray dogs everywhere, intact with their puppies following after them. And so I very much believe that it can be a life-saving procedure because it means, not a bunch of puppies that are on the streets getting hit by cars, starving, filled with diseases, potential vectors for disease spread, especially in the cat situation, these outdoor cats that we're seeing come down with avian influenza in America that are part of these feral populations, doing things like trap, neuter, release, keeping the populations down. That's part of that disease control as well. So it's not just welfare, it's One Health.
Yeah. And when we see it, we've got a big issue with rabies in this country. And it's the same, you've got a roaming population. And if you're going to castrate, there are scientific studies that show that cats roam a smaller area when they're castrated. They're not, like you say, looking for tail. And in the same sense, we see a lot of our welfare organizations' dogs come in with venereal tumors. So we see quite a few of those cases. So obviously managing it from that perspective is really important for us in South Africa. But yeah, population control, and it's a big issue. We have the same with a lot of welfare organizations just not able to financially afford to the care of one pet and having to really try and fund populations to try and get it under control. And there's nothing worse than seeing the reality of the number of pets euthanized in those cases. It's awful. The potential of those pets in homes. So it is a true statistic out there that it does make a difference to castrate and spay. So in terms of your experience, obviously you're doing nutrition as is your special interest, as am I. What is your feeling about these pets? Can we just go into a little bit more depth in terms of, you spoke about high fiber and portion control. How are you finding owners are post-procedure managing their pets after the procedure? And then how are you best advising in terms of owners from a practical perspective, whether they use the sterilized diets or not, being able to manage for their pet so that you can give advice to pet owners so that they don't have obesity being a part of the problem of causing joint disease and whatnot? Can you advise our pet owners?
Yeah, I love to give people resources so that they have some agency in that. So, it coming into the clinic when there's no appointment and just weighing them once a month as a happy visit, so that they don't associate the vet with being poked and prodded, but also they can have that consistent weight. I love giving them resources like the Pet Nutrition Alliance website. They have calorie calculators on there. showing owners what a cup is. Because that was like the big joke when I lived in the South, is that there was these cups that you would get from some of the like popular places, and they would probably be about 3.5 cups worth. And so you'd ask, how much do you feed? I feed 1 cup. They meant that. So, and then for like the non-kibble diets, having a weight scale so that they're actually weighing out their portions, because some of those bags are 18 ounces, some are 12 ounces, some are like 46 kilocalories per ounce, some are like 52. And when you're a 20-pound dog, that's a big difference. So really giving owners like the agency to understand how many calories their pet needs and how to figure that out. And then I don't like to, and some people that's very overwhelming. And so I say, okay, so, we're losing our waist. What are we feeding right now? We feed a cup in the morning, a cup at night, and 3 treats. What if we went down to 2 treats? What if we went down to 1 treat? What if we used the food as a treat instead? What are some things that we can do so that they have that agency to kind of figure it out at home without introducing too much math if they don't want that math? People follow instructions that are easy to follow and straightforward. And so I try and give them like A, B, and C, knowing that what type of owner is more likely to like A, B, or C.
That is really great advice and so informative. I think you're right. I think, obviously everybody being rushed and wanting sort of things and they're sticking with one bit of information and not having that approach where you're providing practical and relatable advice can often cause or mislead owners. So I think, showing the cup and even that everybody can relate to it. I mean, you picked up your Starbucks tea, that's a cup, that's your cup versus the teacup that, so I think it's very relatable, and to be able to provide owners with that support is critical. So thank you. Thank you so much for a really informative discussion. I think this is hopefully really valuable and owners can go away and make informed decisions. But I'm sure as these reels go out, there'll be a lot of questions and follow-ups that we can either direct them to resources. I can hear my kitty cat crying at the door. Excuse the noise. So thank you, Dr. Deer, for your time. It's so appreciated, especially after night shift.
Yeah.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.